Making a difference to the animals that I look after and the people that look after them is really near and dear to my heart. Some days are rough with sad endings, but most of the time it's just really enjoyable and such wonderful work and a real privilege to be able to do.
And meet the rest of the amazing team at Holistic Vets. Sue, Coordinator and ARC's Angel. Dr. Tara, Assistant Vet. Emma, Senior Vet Nurse Extraordinaire. Karen, Vet Nurse Extraordinaire. And Kerry, Receptionist and IT Queen. It's another busy day in the life of the Holistic Vets and ARC team. It's only 9 a.m. and Dr. Lisa has already finished a radio interview, tended to hospitalised animals and injured wildlife that is constantly arriving at the front door. While reception continues to fill up with people coming from near and far, Dr. Lisa has patients already in the consult room waiting for her. Meet Saf, a much-loved dog of 14 years old who's been through the mill. Run over by a car almost a year ago, had a large tumour removed from her stomach 6 months ago, and recently fallen from a car. This poor girl has had a journey. Dr. Lisa checks Safi over and talks with her owner.
In case if you were going to
Sure.
give her an x-ray, I just thought we might just pay and...
Absolutely, no worries. Okay.
While Saf is getting prepped to have x-rays done to determine the extent of her injuries, Lisa checks on Pisa, an adorable cat that was hit by a car and has been left with a broken pelvis and paralysed from the waist down. Due to nerve damage, she's unable to urinate and defecate on her own, which is concerning for her long-term survival. With such severe injuries and after consultation with a specialist, Pisa's local vet had recommended euthanasia as an option. But with her front half being so perky, her owner looked for other options and consulted Holistic Vets.
Pisa's case presents some really difficult challenges. She's come to us having had 2 vets suggest that euthanasia might be the best option for her, yet her owners can't reconcile that her front end is so bright and happy and her back end doesn't work. As vets, our duty is to relieve pain and suffering, and when we're faced with a decision of euthanasia, we've got to weigh up very carefully what's in the best interests of the animals. But for Pisa, I can see that she's not suffering at this stage. Certainly she's got a lot of healing to do, but she's coping really well. And there is a chance, even if it's small, that she might pull through, and if not live a normal life, at least she could live as a handicapped animal being looked after really well by her owners who are up for this challenge. So we've got an interesting few weeks ahead of us. And while some animals have done remarkably well with the therapies that we offer, like our amazing hyperbaric chamber and acupuncture and various other things that we use, and they've come back with health conditions where they've been told before by other vets and specialists that there's no chance, Pisa might not be one of those, but we'll certainly give it a really good go.
Dr. Lisa hopes that with acupuncture and hyperbaric oxygen therapy to help flood her cells with oxygen and promote healing, there might be a chance of restoring some function to the lower half of her body, or at least help to accelerate the healing of her fractures.
Now I've got Pisa in our hyperbaric chamber, and she's about to have a session of hyperbaric oxygen therapy, which basically means getting oxygen at high pressure. Oxygen under high pressure is amazing because it delivers very high concentration of oxygen to all the cells in the body, and it can actually bypass the bloodstream, which is incredibly helpful when there's been traumatic injuries. And of course, every cell in the body to function optimally needs oxygen. So after her chamber session, Pisa will feel nice and relaxed. There'll be some anti-inflammatory effects, and most important, it will help her fractures to heal at a greater rate, and we're hoping that it will also help to regenerate some of her nerves, but time will tell.
While Saf is being x-rayed, a woman brings in a stray kitten into reception that was found on her driveway. We'll check in on her and find out what state the kitten is in after the break. Saf is safely coming around from her sedation and waking up bright-eyed and bushy-tailed. This 42 kg gorgeous girl is carried to her recovery area.
Anal glands can be a messy business, but sometimes it can be wonderful to help to relieve an animal's discomfort by giving them a good squeeze. A lot of the time, animals that chew their paws or drag their butt on the ground or nibble constantly at the base of their tail, they're trying to indicate that their anal glands are full, and they don't always express normally. So one day I was out at this farm checking out some animals, and my client asked me to check out her big Rhodesian Ridgeback Rocky. And Rocky had a few skin issues, and as part of my examination I wanted to check his anal glands because I was highly suspicious that they were full. And I was not surprised with what I found. With squeezing the anal glands, I turned my back to the owner, who was standing at Rocky's head end and giving him attention, while I professionally and in a dignified manner started to squeeze his anal glands to relieve the discomfort. Well, I squeezed them and squirted myself in the eye, which was pretty gross, and I thought, oh no, now my professional dignity has been ruined. But thankfully the owner hadn't actually realized what I did, so I quickly took my shirt and I wiped away the anal gland juice from my face, and that stuff really stinks. And I told the owner it's quite stinky, but it's all done, and she hadn't realized what I'd done. So we went into the farmyard bathroom where she offered that I could wash my hands and clean up, and I thought that's great, but there was no light, there was no mirror and no towel. So I cleaned up as best as I could, but I was still smelling like an anal gland bomb. And then when I was done, I went back to the house and just summarized what we needed to do for her animals. And after that she said to me, gosh, you're right, that stuff really does pong, it leaves a great residual smell. Her thinking that it was still coming from the dog in the meantime, which was just coming in huge waves off my shirt.
After the break, Dr. Lisa finds out the extent of Saf's injuries. And is there any progress with Pisa the paralysed cat? What will Dr. Lisa and Super Sue find in the mystery box this week? And helpful hints to know when it's urgent to get your pet to the vet. Now fresh, 100% grain-free natural pet food for dogs and cats. Brought to you by healthypetfoods.co.nz for a healthier, happier pet.